Good morning, everybody. Boker Tov. I'm Sahlya DJEBBAR, working with Lille. This case was found in Lille, France, in the musculoskeletal area. So, we're talking about a 62-year-old female consulting for hip pain and functional disability starting 2 months ago. She used to be a nurse in private practice, and she has a previous history of ankle fracture in 2009, followed by a myopathy. She had further investigation who were unremarkable. So today, she's complaining about her hip, which is really painful with a disability. It's a bilateral lesion, bilateral pain, but worse on the left, getting more and more intense. She consulted several times her GP, but now she's coming to see a rheumatologist to understand what's going on. She had several medications which didn't work. So, here is her x-rays, and what do you think about it?
Bad.
So I repeat, she suffers from both hips. 62. Any idea? Exactly. So just to understand the first point, she had typical signs of DJD changes of both hips, like joint space, narrowing here, osteophytes, microcysts, and subchondral sclerosis. Those 4 findings were typical of DJD changes of the hip. So here's a little word about the RAA classification of DJD of the hip. Clinical, and now there's a combined classification associating imaging criteria also. So, can you go further with the hypothesis of the lesion? Is it a primary osteoarthritis, or is it due to something else, based on this plain film? This is actually a complication of osteoarthritis, but it can cause the osteoarthritis. Any idea? Sorry? Okay, let's move on. So, here we can see big, huge osteophytes, beak-like. And we can also see here a pseudo-enlargement here internally. Here a little help about the final diagnosis. We had x-rays of both hands here. Can you see something? Here, when you magnify the picture.
It's heterotopic bone formation, periosteal reaction. There's wing-like osteophytes. It's a seronegative spondyloarthropathy. The psoriasis, it's probably psoriasis. Maybe erosive osteoarthritis.
Let's focus on the tuft here. What do you think about it?
Periosteal reaction, soft tissue swelling, and bone formation.
But the shape of the tuft.
Spade-shaped tuft.
Let's focus here also. Do you think it's a normal space?
There's a mouse variastic reaction.
I add this. You compare the shape of the tuft and this shape. It's like an Aunt Minnie case. So, took the overgrowth of the tuft with the hook shape associated with soft tissue. Here, we have radiographs of the feet, showing also abnormalities on the magnified picture. Here we noticed a widening of the joint space associated with an enlargement of the base of the phalanx with a squaring aspect. So, just more help here on the skull radiographs. There's enlargement of the frontal bone with hyperostosis frontalis interna here, with prognatic jaws here. It's a female, so she has a really big jaw. So finally, she had her MRI, showing here T1 weighted images, T2 weighted images here on the right. She had a mass here on the pituitary with an enlargement here of the justice hour.
She could be a minister.
The mass was hyperintense on T1 weighted images, heterogeneous in T2 weighted images, and after GADO we can see an heterogeneous enhancement of the mass. So our final diagnosis was acromegaly, discovered on hip pain. So just a few words about acromegaly. So it's mostly discovered in middle adults with an insidious onset due to a slow progression. But it's a severe disease with major facial changes. So it's considered as a serious condition and can lead to death, essentially with heart troubles. But it's really difficult and tricky to diagnose. So you gotta focus on the external features, especially of the bone of the face. So bone changes are really common. You can see about 50 to 75% of changes in acromegal patients with a late onset, about 10 years. Most common are back and spine troubles like sciatica or diffuse arthralgia. Classical lesion is carpal tunnel syndrome. So, just to repeat the imaging features, those are the most typical findings, like soft tissue thickening, osseous hypertrophy, joint space widening, osteophytosis and hyperostosis due to the higher rate of growth hormone. Late DJD are due to all these features combined and can lead to severe osteoarthritis like for our patient. So just to a bit of illustration of famous acromegal patients, here we can recognize the famous shark, James Bond, and a cute child here, Shrek, just to be to bring a bit of culture here in the radiology topic, was inspired of this French catch player, who used to be famous in the 50s, but he's French. And for French people, a famous acromegal was a TV show player. So thank you for your attention.